Hello everyone, today we're going to be learning about Hodgkin's lymphoma. So what is Hodgkin's lymphoma? By definition, Hodgkin's lymphoma is a cancer or a malignancy of the immune cells, particularly the lymphocytes. It comes from two derivatives of lymphoma, so there's Hodgkin's lymphoma and non-Hodgkin's lymphoma. Today we're going to be focusing on Hodgkin's lymphoma. Hodgkin's lymphoma has many risk factors. A very common and predominant risk factor is the HIV and Epstein virus. Another risk factor is also having a family history of Hodgkin's lymphoma, any kind of autoimmune diseases such as rheumatoid arthritis, which would overstimulate the immune cells, and therefore the lymphocytes would also risk a malignancy of the lymphocytes, and therefore is a risk for Hodgkin's lymphoma. Immunocompromised individuals such as the elderly, the young, and those with pre-existing health conditions are also more susceptible to Hodgkin's lymphoma. There are many types of Hodgkin's lymphoma, so some of the classical subtypes include nodular sclerosis. This is the most common type of Hodgkin's lymphoma and generally has a good prognosis. Mixed cellularity, which also has a good prognosis. Lymphocyte-rich lymphomas or lymphocyte-dominant lymphomas, which have the best prognosis, and lymphocyte depletion Hodgkin's lymphomas, which have the worst prognosis but are also the rarest forms of Hodgkin's lymphoma. Some of the signs and symptoms of this type of lymphoma will be a swelling of the lymph nodes in the neck, so lymphadenopathy, and this is typically described to be tender and palpable, especially if after the patient has drunk alcohol. Other common signs and symptoms may include splenomegaly, hepatomegaly, and also the 3B symptoms, which is unintentional weight loss, night sweats, and fever. They may also be fatigued, malaised, and experience a loss of appetite. The ways we would investigate Hodgkin's lymphoma is through taking a lymph biopsy. So a characteristic feature of Hodgkin's lymphoma on a lymph biopsy is the Reed-Sternberg cells, as you can see on the bottom left. And these are cells with a very large nucleus with two and they're described to have an owl eye appearance, talking about the two nuclei, which is very large and increased and grand. You can also investigate using a full blood cell count, which will have typically raised white blood cells, especially lymphocytes, raised ESR levels due to levels of inflammation, as well as taking a CT and PET scan, which show active lymph nodes, lymphocytes across and throughout the body. We can stage Hodgkin's lymphoma in 4 ways. So there's stage 1, 2, 3, and 4, as you can see in the bottom middle diagram. Stage 1 is when the lymphoma hasn't metastasized, it's just local and has stayed within the lymph nodes of the neck. In stage 2 Hodgkin's lymphoma, the lymphoma may have spread to one or either side of the diaphragm. So this can include the above or below the diaphragm, so the neck or the axillary nodes. In stage 3, it has definitely spread beyond the lymph nodes of the neck, so on both sides of the diagram, so above being in the axillary nodes and below being in the inguinal nodes, and it has spread throughout the body beyond the lymph nodes in the neck. However, in stage 4, the difference between stage 3 and stage 4 is in stage 4, not only has the lymphoma metastasized to other lymph nodes above and below the diaphragm, so that's in the neck, the axillary, and the inguinal nodes. It's also metastasized to other non-lymphatic organs such as the liver, the spleen, and the kidneys. And this is the worst type of lymphoma with the worst prognosis. We would treat Hodgkin's lymphoma through chemoradiation. The mnemonic ABVD can categorize the drugs. So that would be adriamycin, gliomycin, vinblastine, and dacarbazine can be used. We can also, in other patients, we can use the drugs bleomycin, etopside, adriamycin, cyclophosphamide, oncovin, procarbine, and prednisolone. Hodgkin's lymphoma is quite typically affects the young, so its first peak is for those aged between 18 to 24, and there is also a second distributional peak in those within the ages of 70 to 74. Some of the risk factors or side effects and complications of chemoradiation is that if it was particularly with radiation, if we target the lymph nodes in the neck, there's a risk of the thyroid gland being affected and metastasizing, leading to cancers of the thyroid and hypothyroidism. Thank you for listening to this very short presentation on Hodgkin's lymphoma. I hope it cleared up and provided a brief overview of Hodgkin's lymphoma, and next time we'll hopefully go over non-Hodgkin's lymphoma, which is another branch of lymphoma. Thank you for watching.